So before I talk about tests, let me reiterate this fact that a very good clinical history is essential to make a diagnosis of an immune deficiency, because often these patients undergo several tests because they are suffering for many months and years. They have a bundle of investigations that they often come to us with, and still they don't have a diagnosis. So before investigations, it is a good clinical history as to what is the problem of the patient. Where are these infections? Is it in the lungs? Is it diarrhea? Is it skin infections? So what are the kind of infections? What are the kind of pathogens that this patient is getting infected with? The other question that I was just talking about is a good family history. Having a very detailed family history sometimes not only tells us there is a genetic problem, but what is the pattern of inheritance? Even that we are able to make out. Now, once we have suspicion, we can start investigations. Now, let me tell you simple investigation. Sometimes we get clues from very simple investigations. A hemogram, or what we say the complete blood count, is something that most patients would get done when they are unwell. But in a young infant, if the complete blood count is showing very low lymphocyte count, lymphocyte is a type of WBC, white blood cell. If the lymphocytes count is very low, below 3000, we suspect severe combined immune deficiency. This is a very serious immune deficiency. If the neutrophil count, which is another type of WBC, is very low, we think of severe congenital neutropenia. If the WBC count is very high, say sometimes way above 1 lakh, we talk about leukocyte adhesion deficiency. Sometimes boys come to us with very low platelet counts, thrombocytopenia, and we suspect Wiskott-Aldrich syndrome. So sometimes it is basically done, the routinely done investigations give us clue to pick up the diagnosis. However, when we suspect a disease, we carry out a group of investigations called immunological tests. Now, this is essentially to check for the immunity of a patient. So we do serum immunoglobulins. So these immunoglobulins are fighter antibodies that we all have in our body. And if somebody has very low immunoglobulins, we know he's got an immune deficiency. We also check for different types of white blood cells, the lymphocyte subsets. We do some specialized testing like the dihydrorhodamine dye test based on our suspicion. So this is the second level of investigation where we do an immunological investigation or immunological screen. And whenever our suspicion is very high, to confirm the diagnosis, we do something called a genetic test, which is also a blood-based test. So often 1 to 2 ml of blood is given to a genetic lab and they can perform something called an exome sequencing and look for the exact gene defect which has caused this problem. So this is how we can arrive at a diagnosis in most patients.